the pharmaceutical industry has told us for so long that psychiatric conditions are chemical imbalances that need to be corrected with medication. That's what I was taught back in the 90s and early 2000s when I was trained to become a psychiatrist. I use that phrase thousands of times with patients: chemical imbalance, chemical imbalance, chemical imbalance. And but I don't have any tests that I can give you to find out whether or not you have a chemical imbalance, unless I'm doing a fancy research study with thousands very expensive equipment. I have no idea whether or not you have a chemical imbalance. And so what I was doing for so many years was basically practicing in the dark and saying, well, you have this list of symptoms. This list of symptoms falls into this diagnostic box. It's major depression, or it's PTSD, or it's ADHD, or it's OCD, whatever it is. You told me these symptoms in your history. They most closely fit into this diagnostic box over here. What medicines do I have that might help you? And so I've got this list of medicines, and I literally guess which one to try first. I mean, it's based on experience. It's based on some education and residency. I'm not completely blindly choosing a medicine, but I actually have very little to go on when I am prescribing medications. I have no way to know which one is going to be the most useful one for you to try. And so it can be a really frustrating, lengthy trial and error process, and really frustrating for both people, both the psychiatrist and for the person who's coming to the psychiatrist for help. I mean, it can take a year or two to find a medicine that might be worth taking. And sometimes we don't find one at all. And then the medicines, when they do help, because they do help some people, I want to make it really clear that medicines have an important role to play. I still use them in my practice all the time. Especially in emergency situations or more complicated situations, or where diet hasn't helped enough, or where people can't or don't want to change their diet. There are lots of reasons why we still need medications, but the medications that we have fail most people. They don't bring enough relief to enough people. And the people that do get relief from medicines often pay a hefty price in terms of side effects. And so we don't have a lot of good options in psychiatry. And I think psychiatry is the field where we need dietary changes more than any other field, because the existing treatment options we have are so limited.
Yeah. I'm so glad that you mentioned that. And that's something I always try to bring into the podcast. Nobody is ever suggesting anybody get off of their medication, because that is dangerous, can cause horrible side effects in themselves. It's life-threatening. So we're not suggesting that at all. But there are other things that we can add, even to make, I would argue, medications more effective. If we're eating more animal protein and getting more tryptophan and getting more tyrosine and getting more methionine and some of these important amino acids, then we're probably going to have more for the meds to work with. Would you agree?
Well, yes. If you kind of use a food first philosophy, a food first approach, what you really want to do is start with the healthiest brain you can get. Shore up the nutritional status of your brain by making sure you're feeding it the right things, not feeding it nourish, protect, energize. So nourish the brain with all essential nutrients. These include the nutrients that you need to build your neurotransmitters. So you're saying tryptophan, which is an essential amino acid, comes from dietary protein. You need iron, for example, in order to make certain neurotransmitters. So you need amino acids, you need certain minerals. And then the other thing that is really important is, in addition to making sure you've got the raw materials to make those neurotransmitters, you also want to avoid taking in ingredients that will throw the balance of those neurotransmitter pathways off. Because even if you have all the right ingredients to make the neurotransmitters, there's things like eating refined carbohydrates and vegetable oils and things like that. Eating the wrong foods can throw off the pathway and tilt it in the wrong direction. And you can end up with a huge imbalance in neurotransmitters, even though you're eating all the right foods. So it's not just enough to eat the right foods, you also have to avoid eating the wrong foods. So in the book, I give an example of a key pathway in the brain that regulates the activity of lots of different neurotransmitters in the brain, the serotonin, melatonin, dopamine, and also these two really important neurotransmitters in the brain called GABA and glutamate. And these are like the brain's gas pedal and brake pedal. And they're probably the most important neurotransmitters in the brain because they're so abundant and so widespread throughout the brain. And so it's really the balance between those two. GABA is the calming neurotransmitter, and glutamate is the stimulating neurotransmitter. The balance between those two essentially determines the brain's overall activity level at any given point in time. If you eat the wrong foods, if you eat too much refined carbohydrate or vegetable oils, things that are going to cause inflammation and oxidative stress inside the brain, these very damaging forces, the inflammation and oxidative stress throw the GABA glutamate system way out of balance. And suddenly, you've got less serotonin and less melatonin and more dopamine and less GABA, but now you can have up to 100 times more glutamate being produced, the gas pedal, than you would at a peaceful kind of Zen baseline. And no wonder people can't sleep or feel anxious or feel, that they're in overdrive. Their brain is in overdrive.
Yeah.
Glutamate is the brain's primary excitatory neurotransmitter, and you've just increased its levels by up to 100-fold. And that's a chemical imbalance. But that's not one you were born with. It's a chemical imbalance that you have now created by eating, say, for example, or maybe drinking a couple of cans of soda, or, eating a bag of chips, something that's got a lot of refined carbohydrate and vegetable oil in it. So, and I think, a lot of people don't realize that the foods they eat have a powerful influence over not just whether or not you can make the neurotransmitters, but but the balance between them also.
Yeah. Yeah. And you called that, I believe, I wrote this down, the unholy trinity of inflammation, oxidative stress, and insulin resistance. That's the unholy trinity of destructive forces that create these neurotransmitter imbalances.
Exactly. Because the other thing you need in order for the brain to function properly is it needs to have enough energy. And if it doesn't have enough energy, it won't function properly, and all of these systems can be thrown out of balance. And so the insulin resistance piece, and I don't know how much your listeners already know about insulin resistance. Sometimes it's called prediabetes, sometimes it's called metabolic syndrome, sometimes it's called hyperinsulinemia or high insulin levels. This is a really, really common issue. The majority of us now in the United States and in growing areas around the world now have at least, I think it's more than 90% of us now have at least one marker of insulin resistance, and more than 50% of us have full-blown insulin resistance, every symptom. Wow. And so most of us are not metabolically healthy anymore. What that means is you're eating and you're living your life in a way where your insulin levels are running too high. And so that can mean you're eating too many of the wrong carbohydrates too often, or you're not getting enough exercise, or you're eating too frequently, or you're eating too much food. All of these things will keep your insulin levels higher than they should be. And so when insulin levels run too high, the brain starts to become insulin resistant. And it becomes harder and harder for insulin to cross into the brain. And that's not good, because the brain doesn't just need glucose. It does need some glucose from blood sugar. It needs that's one of its sources of fuel, but it can't make full use of that glucose. It can't turn that glucose into energy to full capacity without adequate insulin. So you can have plenty of glucose. Your brain can be swimming in a sea of glucose, especially if you're eating too many of the wrong carbohydrates too often. You'll have all kinds of glucose in the brain, but you won't have enough energy you won't have enough insulin to use it to full capacity. So you can be swimming in a sea of glucose and your brain can still be slowly starving to death.
Yeah.
And if there's not enough energy any number of things can go wrong. And we now know that insulin resistance is, we see insulin resistance goes hand in hand with a lot of the psychiatric conditions that people come to see me, for help with: bipolar disorder, major depression, psychotic disorders, cognitive decline, and lots of other conditions as well. So it's really important to make sure you're feeding your brain nourishing foods, protecting your brain from damaging foods, avoiding damaging foods, especially the refined carbohydrates and the vegetable oils, and that you're energizing it properly by keeping your glucose and insulin levels in a healthy range.